will give the presentation about our my study. Also today, it also published in Lancet Oncology. So this study is about, the nasopharyngeal carcinoma is called a cancer tumor, and it's almost in China. Half of the patients was in China. So today the study was focused on the adjuvant chemotherapy. The standard chemotherapy for the local regional NPC was the concurrent therapy and the adjuvant chemotherapy, the cisplatin and the 5-uracil. This study we tried to compare with a new chemotherapy regimens as gemcitabine and the cisplatin to compare with the standard care adjuvant chemotherapy is the cisplatin and the 5-uracil. So we finalized, especially we choose the patients with the high risk of distant metastasis for the patients with stage N2 or N3 with the high stage. So this part of patients maybe have a high risk to develop distant metastasis. So totally and 240 patients were randomized to the two groups. And the PF group is the standard care is the CCRT, concurrent chemotherapy plus the adjuvant and the PF regimen. Our study group is the CCRT and plus the GP as the adjuvant chemotherapy. And after with the meeting for about 40 months, and we finalized the 3 years and the progression-free survival is about 83%. But for PF group, is about 71%. So about the 3 years and the progressive and increase about 10%. This is the main finding of our studies. So, but also the GP regimens can reduce the risk of the local regional relapse. Also reduce the risk of the patients under emergent distant metastasis. So, but for the 3 years overall survival, because of times are still relatively short, and so there's no difference between the 3 years overall survival. So. The most important findings of our study is that we try to recommend the GP and the cisplatin and plus the gemcitabine as the new adjuvant chemotherapy for the NPC patients. That's the most finding of our study. But in the future, maybe now our study will try to recommend maybe the GP as the regimen will replace the standard care of a PF regimen in the future. But in the future, maybe we talk about it, maybe even we use the concurrent chemotherapy plus the GP adjuvant chemotherapy, there's still about 20% patients will emerge distant metastasis for this part of patients. So in the future, maybe we need to try to the combination about immunotherapy and the PD-1 antibodies and try to increase the efficacy of this part of patients. Another aspect, they still continue to find more effective biomarker, trying to screen the high-risk patients. You find more effective, more intensive and the treatment and for this part of patients. But until now, there's still about 20 of the patients will develop relapse or distant metastasis. How cure this part of patients? We need still explore more treatment, maybe targeted therapy, immunotherapy, and we still have a long way to go.